Well, for more on the coronavirus, we cross to our correspondent in London, Stuart Smith. Thanks very much for joining us, Stuart. So, very big news to hear that the health minister of all people in the United Kingdom has the coronavirus. And on top of that, she's had a lot of contact with parliamentarians and other ministers in cabinet and so on. So what's the reaction?
Well, it is a shame. Yes, the Minister in charge of Public Safety has developed symptoms of the coronavirus. She was tested yesterday and it came back positive, and when it did, she made sure, as is the advice, to contact Public Health England so they could begin contact tracing. But as you say, a very busy person who meets a lot of people, and including the Prime Minister on International Women's Day. The government is refusing to say whether Mr Johnson, the Prime Minister, has been tested, but as we can imagine, if he does begin to develop symptoms, he will be tested for sure. The other problem, of course, a busy MP has been voting on bills in the House of Commons, and we have over 600 MPs in the House of Commons, and voting is traditionally done in person in these rather small voting chambers. So could have come into could have come into contact with many more people through that way. So she was praised by the Health Secretary, Matt Hancock, for taking all the right steps by self-isolating and letting Public Health England know who she's been in contact with.
So I understand that the NHS, that is the National Health Service in the United Kingdom, is ramping up because it does believe that there's going to be a multiplication of cases. Just tell us a bit more about what they're doing.
Yeah, the National Health Service is the UK's public health provider. It's free at the point of contact, and they're testing about 2,000 people at the moment every day. What they want to be able to do is ramp up their testing procedure so that they can test for 10,000 people a day and try and get the results back within 24 hours. And so doing that will hopefully mean that more cases can be identified more quickly, but it does also show that the UK is expecting to still see further exponential increases of cases.
Of course, we know that the health implications are very concerning indeed, but also the economic, and we know that world bodies have come together to say we're making so much money available, the World Bank making $12 billion available, the IMF $50 billion. We're hearing about individual countries also putting money forward to deal with the health crisis. And of course, we heard today that the BOE, the Bank of England, decided to cut rates by 50 basis points, and it's something that they've not done in a long time. Speak to us about that.
Yeah, so the Bank of England has dropped rates from 0.75 to 0.25, which doesn't sound like a lot, but in relative terms, that's a cut of over half. And this is designed to stimulate cash flow and to provide confidence within the economy. The Bank of England's governor, Mark Carney, said he was particularly concerned about the small and medium businesses who may not have the resources to last over any major period of coronavirus measures. So what they are also doing, as well as lowering interest rates, is providing cheap loans to small and medium businesses to help them get over the peak of the coronavirus epidemic, which public health officials in the UK said is probably coming in the next 10 to 12 days.
Stuart, before I let you go, I understand that people are really slowing down on going shopping and just doing public things. Is that your observation?
Perhaps slowing down on shopping, but those who are going shopping are taking a lot. There has been an issue with supermarket shelves being cleared of toilet roll being the big one, which is not immediately understandable, but toilet roll provisions have been lowered, and yeah, some panic buying, but not much.
All right, Stuart, we're going to leave it there. Thank you very much.